you've touched on what you love about working in a skilled nursing facility. You started with that one thing is that you refer to, to experts, whatever you find out about the patient. So what else do you love about working in a sniff?
One thing that I love, Johan, is again, I love the I, again the communications, the
Hmm.
team base,
Hmm.
and I guess the respect. Again, everything is just kind of what I've acknowledged to, you
Hmm.
know.
Right.
I definitely love that. And one thing that so what I've always wanted growing up is I wanted to be in a profession, a medical profession,
Hmm.
where I wanted to study so hard, where just mentally in my head, I'm going to study so hard where this patient will only get better with like my knowledge. That's what I think,
Hmm.
right? So I think that is kind of a very good understanding when you're in school. Hey, even though it's not true, hey, I'm I'm very good in my craft to where this patient will only be better with my treatments, but I have to continue. What if they have a diagnosis that I'm not too familiar with? I have to keep pushing. I have to keep continuing. And the important thing too is with that mindset, you have to be humble,
Hmm.
of course. You have to be very humble.
So communication, being humble, respect among peers, and referring to other experts. What are the challenges now that you have encountered in your practice? You said you've been in the skilled nursing facilities for 4 years already. You've worked there for four
Hmm.
years. So, what are the
Hmm.
challenges that you've encountered um, working in a team, working in a sniff, probably problematic cases or patients?
Well, one definitely is PDPM, right? And the
Hmm.
reason why I say that is because I don't know what's going to happen just yet. Okay.
Right.
So far, the main thing that has occurred is just some patients have decreased on time.
Hmm.
That's the main thing.
Hmm.
What else? Problems? To be honest, Johan, I love where I work.
Hmm.
I'm trying to think of issues right now.
Hmm.
Um, I think one thing too is perhaps sometimes because of insurance,
Uh-huh.
perhaps
I
the
agree.
patients at times go home earlier than what is expected, or they go home earlier, um, maybe despite a recommendation of yours that you would like to continue for maybe a week
Hmm.
professionally. But again, that's in all settings,
Hmm.
right? That's in all settings because we have to deal with insurance.
Right.
But that's definitely mainly it, Johan.
Hmm.
I would say that, yeah, because the place where I work with is great. Perhaps another thing,
Hmm.
another downfall
Hmm.
is because you work are working with so many people, for sure, you won't get along with everybody, right? But that's okay.
Uh-huh.
You really don't need to get along with everybody. It's preferable.
Hmm.
But the main thing is you're professional in what you do and you do your job, which
Hmm.
is you try to make the patients better. That's the
Hmm.
number one thing. That's what it ends up with.
Right.
But again, our building has more than I think 300 employees, I think. So
Wow.
of
It's
course there
big.
might be a time when, yeah, it's huge, and two floors, two different units, and of course there might be maybe a CNA or a charge nurse or even an OT or a
Hmm.
PT that you don't get along with, but just because of the constant communication that you are required to have for the
Hmm.
benefit of the patient, you are required to communicate with them because if you don't, that patient will be negatively affected.